Hello. Bon après-midi. Je m'appelle Carrion Pleats. Hello. Great to have you. Could I have a hand raising of any of the young executive leaders in the audience? How about the alumni network? Alumni? Yes, got a few alumni. Great to see you. Thank you for coming out, and for all the rest of you, thank you very much for coming in and being here in support of these amazing executive leaders from across the globe. So I want to highlight that you should put your phone on silence. Otherwise, I will make you stand up and dance for the audience. So from March to September this year, 47 participants of the Young Executive Leaders Program connected across 32 countries to develop their leadership skills, to learn from experts through 9 master classes, and they were divided into 9 subgroups. Kaiser Permanente has been a supporter of this program for a couple years now. I think we've got one more year, even though I think I might get roped into doing this for a few more years. But it is one of the most amazing programs that our organization supports. So if you don't know anything about Kaiser Permanente started in about 1945, so we have been in existence for over 80 years, which is pretty young in comparison to many other healthcare systems. But for us, we started and were birthed from an experience of needing to ensure total health for those who were building ships during World War II. We needed to ensure that the individuals to build those ships within a day were active and healthy and thriving, no matter what their nationality was, no matter what their ability to pay for healthcare services. It was a calling above and beyond service. And that mission has stayed with us for 80 years. So I'm very proud of the organization that was birthed in Oakland, California, and is now in 9 states. And I also want to highlight, it has been very clear and obvious to me, participating in the International Hospital Federation, that there is so much that joins us together that we share across the entire globe in trying to solve the world's healthcare problems than there is dividing us. And I think the world needs a little bit more togetherness and support and love these days. And you'll see this from this amazing experience. So without further ado, we have 13 speakers who get 5 minutes or less, right? Right, so don't make Carrie pull out the wrap here. I do want to, so again, phones on silence, and make sure that you can learn more about the speakers, because they won't have a lot of time to give their background in the app. All the details are there. And also, I think everybody probably knows, if you need simultaneous translation, there's a QR code at the front of the door. All right, we're going to start with our first one. You guys ready? Okay, they're like totally ready to go. I love it. All right, so our first presentation, number 1, is AI in Healthcare, Transforming Today, Shaping Tomorrow. Dr. Kuala Alaji, Consultant Medical Education and Research from Dubai Health Authority, UAE. From Yale Working Group number 7, we'll discuss how AI adoption is a leadership imperative that requires building trust, bridging inequities, and guiding teams through change. All yours.
So I have to start very quickly. I have just 5 minutes to summarize all the hard work we have done as a group. Before I start my speak, I have to introduce my wonderful colleagues, and Angela from Germany, Thomas from Norway, and JR from Philippines. So I want to bring this important story that I have been in a team where we started the telemedicine first in Dubai in 2018. And when we started the telemedicine, we had to run this project over 1 year. To provide alternatives channel for the patients to have a 24-hour access to the family physicians. And when we started this project, there was 2 assumptions. One assumption is that elderly doctors will not be able to adapt this technology. It's very challenging for them. And the second assumption that the elderly patients will face a problem with the technology and adapt the telemedicine. And because we have to run it in 1 year, so what we did, can we go back? So what we did, we just take the senior doctors, and the reality was those doctors was doing well and great because of their wisdom, and the more patients who used the telemedicine was the elderly population. So my message is never assume that the tools will be very challenging, and you have to always keep in mind telemedicine or AI is just a tool that help us to deliver the service. Knowing that we have a shortage of 10 million of healthcare professionals, so we have to act faster and we have to adapt the AI. AI is a tool that help us in extending clinical expertise, improving diagnostic accuracy and preventive, and can help us in optimizing resources because we can use AI in documentations and saving times and enabling to predict the disease. This is our examples where AI has been shown a very positive case, 94% accuracy in stroke detections, and mammogram screening, it's shown being effective, and sepsis predictions, and respiratory failure and cardiac arrest. So with AI, it will help us to reduce unnecessary documentation. We are spending a lot of time writing documentations, billings, and doing a lot of stuff. AI proven that it can help us to reduce this unnecessary work, where AI can just simply write the notes and get the accurate ICD diagnosis and do the billings. With the digital twins, where we can having a virtually similar to the real world, and we can test and have test resource allocations, make a policy, because we can see how is the life in the digital world. Here are a few showcases. In UAE, we have used AI in reducing no-show and in genome project. In Germany, they use it in cancer screening and psychosis detections. In Philippines, they use it in AIs and telemedicine, and Norway in bone fractures detections. This is our use case, and the message here, we should have national strategy, clear governance, workforce preparations. Patient safety is number one. And where we are heading, we are seeing the AI will help us to make a workforce multipliers. The one who is using AI, not like the one who is not using AI. We are moving toward precision medicines, where we are using AIs, genomic informations, electronic medical record informations toward predictions. Those are challenges that related to trust, data quality. We don't have standards of data, and privacy and ethical regulations, where the AI will be accountable or not accountable, where we are moving toward responsible AI, where the AI should be transparent, fairness, safety, privacy, and accountable, and it should be oversight by human, especially when we are talking about healthcare and we are providing a diagnosis, or we are providing a medical advice. We have to adopt the responsible AI, and we have to move toward that vision. So how we are capable of building the literacy, it could be different tiers. Tier one, where you can just help everyone to understand what is AI, what are the challenges where we can use AI, and what is the red line we shouldn't cross in AI. Then you can have a clinical user or advanced, and then the champion, and you have a correlation between IT, physicians, sorry, but we have to respect the time. And then my message that you have to conduct an AI awareness, you have to identify and empower clinical and IT champion, you have to establish your own governance if you don't have it, and you have to adopt the responsible AI and start as small, do a pilot, and then later on scale it up and adapt it more and more. And that's it. And if you want to know more, you can access our report, because our report has been published in the IHF website. Thank you.
Fantastic. Thank you very much. All right, now we have reducing clinical risk through AI-enhanced decision support. Ms. Mariam Arasi, Senior Specialist, Lead of Women's and Children's Health Model of Care, Department of Health, Abu Dhabi, UAE. From Working Group 1, we'll explore how innovative clinical care models and integrated care frameworks enhance quality, safety, and patient outcomes. All yours.
Good afternoon, everyone. I'm Mariam Al-Raisi, and I'm honored to present on behalf of the Yale Team 2025, leaders from Portugal, Oman, Ghana, UAE, and Georgia. So our team explored how AI can reduce clinical risks when it's guided by human-centered leadership. Across the healthcare system, clinicians face rising complexity, from data overload, staffing pressures, and fatigue. AI promises support, but unless it strengthens clinical judgment and safety, it simply adds more pressure. So our research showed that 2/3 of the hospital already use AI tools, yet barely 1 in 10 hospitals have formal governance framework. That shows adoption is racing ahead of accountability, and leadership must close that gap before trust is lost. So when used responsibly, AI can save lives. At Unity Health Toronto, an early warning system reduced unexpected mortality by 26%, and predictive analytics have cut readmission by 20%. Measured impact proves that safe design delivers real outcomes. So our team focused on one core question: how can leadership make AI safe? We examined decision support system through 3 lenses: design, governance, culture. Because technology alone can never reduce risk, people do. So AI touches every stage of care, from prediction, diagnosis, treatment, and monitoring and learning. So we know that AI is a supportive tool, but also it's help us in improve not only accuracy and efficiency, but also preserve empathy and safety. So in Portugal, AI-driven triage tool helps clinicians spot patients at risk from deterioration sooner. It accelerates decision-making without replacing clinical judgment, showing AI and expertise can work hand in hand. And in Oman, IHF platform integrates predictive algorithms to detect colorectal cancer earlier. It turns data into prevention proof. When AI fits local workflows, it moves care from reactive to preventative. And we do have another example from Ghana. An AI forecast medicine demand, and a drone delivery brings supplies to remote villages. Predictive supply meets equity and action. Technology used for efficiency alone, but make sure it's accessible for everyone. And the final example in Abu Dhabi, the Population Health Intelligence Framework analyzes community data through Malaffi. It identifies high-risk groups. So over 3,700 clinicians were trained in ethical AI use, showing how governance and innovation must grow together. So, however, with all these AI successes, we must stay vigilant. AI can only introduce automation bias, alert fatigue, governance gap, and equity concerns. The greatest risks aren't technological alone, they are also human when we stop questioning the systems that we build. So to guide us safely with AI use, we developed a leadership framework anchored in 4 domains: vision, values, empowerment and capacity, and integration and design, and governance and accountability. And in the core, it's human-centered intelligence. So what does that look like when it turns into principles? So we first have to define purpose, build oversight, co-design with systems and clinicians, and educate the teams. These actions turn ethics into everyday practice and make AI a true partner in safe care. So the future of safety will be defined by trust between humans and machines, between leaders and teams. Empathy, ethics, and global collaboration will matter more than any algorithm ever could. I want also to end my presentation with one note from my team, that technology is powerful only when guided by humanity. Together, we can reduce risk, build trust, and shape a future where AI truly serves people. Thank you so much.
You can tell a theme of AI coming through here. So next up, we have empowering healthcare delivery through digital transformation and AI integration. Am I like hitting things? Is that what's causing the problem? Okay. Watch out for technology. Next up, we have Javier Busi for Digital Transformation, Innovation, Data, and Quality Manager of Hospital Clinic de Barcelona, Spain. Javier from Yale Working Group number 9. Where's Yale Working Group number 9? Okay. We're going to have to start a competition of who can be the noisiest. I have a feeling 9 might hold it out at the end. That's good. We'll discuss their vision for future-ready hospitals. Javier?
So good afternoon, everybody. It's a pleasure for me to be speaking today on behalf of my group. So how as leaders we can empower healthcare delivered through digital transformation and AI integration. So I need to wait. So I think we all agree these days, globally, there's an urgency to act. We are facing major challenges in terms of like workforce shortage, financial constraints, increase in demand, and a lot more. So how technology and AI can help us tackle these problems, because it's a solution it's offered to us. It's a solution, but it's not a strategy by itself. So we as leaders, we need effective leadership to guide this change in our organizations, balancing technology, human values, and behind healthcare in a sustainable way. So effective AI integration requires an holistic approach that balances this organizational mission, our processes, our technology, and workforce transformation. AI has demonstrated good results in these 4 areas and can bring quick results for helping us to focus again on what matters, which is our patients. Nevertheless, to make the transformation, we will require new roles and skills. AI won't replace our work, but it will reshape it. So we will have to invest also in digital literacy for our professionals, so they acquire new skills, and we must not forget that technology without humanity is something that doesn't work. So with all this context, we decided to identify the best practices and level of adoption of AI in our respective countries. So here you see briefly an overview of the current adoption of AI in each of the countries, areas of implementation, and challenges that are being faced more extensively in the report. But the main message here is that AI adoption is being catalyzed by both public and private funding. So here you have the IHF model, which gives us leaders the domains and competencies that we need to take into consideration when embedding AI with ethical, strategic, and collaborative approach into an organization. So what we decided was aligning all these domains and these competencies with the lessons learned from each of the countries and try to identify the guiding principles, which you can see here, that we as leaders we need to consider when implementing AI into our organizations. So first of the pillars for a successful AI integration is about our people, which means empower them and engaging them. So successful transformation will be about them, not about the technology. So here you see a model of the Kerber-Ross change model. So we need actual champions to shape solutions together and embed them into our organization. But champions need training. We, as leaders, also need training. So building digital confidence across every level of the organization is going to be essential to turn fear of change into actual empowerment. And success will be when they just don't adapt to change, they actually lead it. So, of course, we work under certain standards of quality. So AI can be isolated from our current processes and quality standards. And to be fully integrated, we need to consider that this solution must be safe, transparent, and help us to predict risk and prevent harm. And must be included within our cybersecurity and quality frameworks. And last but not least, if we can measure it, we can improve it. And AI is no exception. So we need metrics that go beyond the numbers and reflect what truly matters, which is patient outcomes, staff well-being, and quality of care. So to end up, we know about the guidelines. So what about the implementation? So I want you to leave here with the 3 E's model, implementation model, which is enable, embed, and evolve, which mainly wants to mean you need to set direction with clear vision, start small, prove value, and grow sustainable. So you need to push for acceptance and preference within the organization. So as we've been seeing these days, really AI is not something that's going to be stopped, and this is our time to act, to embrace it and push it towards our organization to be more effective and recover time for our professionals. So thank you all for your attention, and we will be happy to connect with you.
A lot of focus on AI, but at the same time, very much focused on the people. So thank you for that. Next up, we have a presentation, Contemporary Leadership Shaping a Culture of Innovation. Ms. Zachary, close, Secretary of the Board of Directors, Horatio Odeber Hospital in Aruba. Zachary from Yale Working Group 5. Where's 5? Woo, woo, woo. Okay, good. We'll examine how modern leadership strategies influence and shape an organizational culture that supports and sustains innovation. Welcome to the podium.
Bon dia. Let me jump right into it. Healthcare today feels like trying to keep a garden alive in time of drought, right? Resources are tight and every job counts. Innovation isn't luxury, it's survival. And leadership is what keeps the roots nourished and the garden growing strong. Innovation, just like plants, grows where leaders provide sunlight and space. Some leaders can scare creativity before it blooms. Not giving it water can starve new ideas until the garden withers. Empathy and trust help innovation grow stronger than micromanagement ever could. Innovation helps us do more with less, achieving better outcomes, smarter systems, and happier teams. But innovation can't grow in the dark. Leadership is the sunlight in the garden, providing direction, warmth, and energy. Without it, even the brightest ideas struggle to take root and bloom. Our team asked what sounds like a simple question: how do leaders actually build a culture that sparks innovation? It's one of those questions that may seem easy until you really start digging in, because leadership isn't just about management or structure. It's about mindset, curiosity, and letting ideas breathe. Because of its complexity, we broke it down. First, which leadership styles spark innovation? Second, what role does leadership play in reducing resistance to change and enhancing adaptability? And third, how does leadership facilitate collaboration across functional and bureaucratic boundaries? We reviewed 30 peer-reviewed studies and focused on what works now, especially in healthcare, because just like social media, it's fast, adaptive, and human. We also conducted a survey amongst the Yale 2025 cohort and the alumni, and we interviewed different leaders across the globe. Our review showed that one type of leadership is transformational leaders. They inspire curiosity and courage. These are the leaders that say, "You can do this, and I've got your back." They fuel resilience and creativity. When people feel safe to fail, they start daring to succeed. Another type of leadership is transactional leaders. These are more like the rule keepers. They make sure things run smoothly. These type of leaders are really great for stability, not so much for innovation though. But even structure has value. When used wisely, it keeps wild idea from turning into chaos. Strategic leaders design systems that make innovation possible. They remove barriers and connect ideas with action. Distributed leaders share the stage, empowering their teams to take ownership and turn vision into reality. Together, they show that innovation isn't a solo act. It thrives on trust and collaboration. Our review also showed that great leaders walk the talk. They create psychological safety, model curiosity, and balance risk with stability. When leaders admit, "I don't know, but let's figure it out," innovation feels safe. When we explored psychological safety deeper, we found that it's the secret to innovation within teams. Once leaders start replacing "don't you mess up" with "let's see what happens," creativity explodes. Our Yale cohort showed that great leaders are just like skilled gardeners. Great leaders are part coach, part cheerleader, and part problem solver. They tend the soil of trust so their team members don't strangle each other. They align the sunlight just right so every branch grows towards the same vision. They make sure people have what they need and eliminate what slows them down. The results of leaders worldwide showed that the most powerful ideas don't come from the top. They sprout from the front line, where the people are the closest to the real challenges. As leaders, our role isn't to prune every branch, but to listen and create space for growth. When we nurture innovation every day, through trust, through openness, and through encouragement, it blooms naturally, instead of being something forced from above. Great leaders reward curiosity, and great leaders celebrate learning. To wrap up, the results across every inquiry were consistent. Great leaders are transformational. Great leaders are also strategic, and they are distributed. They make innovation feel safe, they make innovation feel shared and fun, because leadership doesn't just manage change, it creates it. Thank you.
I love that. I know we've got some gardeners in the room. Next up, we have Beyond Borders, Building an Engaged Global Health Workforce. Ms. Kelsey Fuller, yes, Director, System Value Performance and Transformation from University Hospitals Health System in the US. Kelsey from Working Group 6, where's 6? We'll focus on international partnerships solving the workforce crisis. Good job, 6.
Thank you. Around the world, health systems face an urgent challenge, a shortage of engaged and supported workers who are essential to delivering care. Our amazing, brilliant group set out to explore workforce engagement from an international perspective. What we found reaffirmed a simple but profound fact, that behind every innovation, there is a person holding it all together. The World Health Organization projects a shortfall of over 11 million health workers by 2030, most in low and middle income countries. But that's not just a number. It's millions of patients left unseen, clinics left understaffed, and communities left without care. Behind every data point are real people, clinicians and caregivers who show up every day despite limited resources. Their voices and experiences are at the heart of engagement. So to better understand engagement from those living it every day, our team spoke with healthcare professionals across our own systems around the world. We asked what drives them to stay in this work. Here's what they shared, a reminder that for many, healthcare isn't just a job, it's a calling.
As hallmark as it sounds, making an impact is what I value. Nothing makes me feel better than a project, big or small, where I can say, success or not, I impacted this many people.
Voices like that capture what unites us, a shared purpose rooted in compassion, service, and connection. Whether you're a nurse in Portugal or a physician in Cleveland, that purpose feels the same, to make a difference. Engagement grows when organizations protect that sense of purpose instead of drowning it in paperwork and burnout. Yet we know no country can solve this problem alone. Partnerships across borders through education, shared research, and policy alignment amplify our impact. When nations collaborate, they don't just exchange knowledge, they exchange hope. Engagement becomes a global responsibility, not just a local afterthought. Healthcare talent often moves, sometimes out of necessity and sometimes in search of growth and opportunities. Labor mobility can elevate lives, but also leaves voids behind. To truly engage our workforce, we need fairness, systems that allow professionals to move freely while strengthening, not depleting, the communities they leave behind. Education is one of the strongest bridges we can build. Through academic partnerships, we share not only knowledge, but perspective. shaping clinicians who understand both global health challenges and local realities. These partnerships turn engagement into empowerment, rooted in curiosity and connection. And global organizations such as the World Health Organization, Global Health Workforce Alliance, and Africa CDC create frameworks that unify nations around shared goals. These efforts prove that progress isn't about one country leading, but about all of us coming together for a shared accountability. And digital tools are redefining what engagement can look like. A clinician in a remote village can now consult with a specialist across the world in seconds. When used ethically, technology doesn't replace human touch, it strengthens it, connecting people to knowledge and to one another. Across continents, health professionals living abroad are finding creative ways to give back, from virtual mentoring to short-term missions. These efforts turn migration into mutual benefit, creating a cycle of knowledge exchange and a renewed connection to purpose. Yet, engagement can't survive on passion and purpose alone. It requires systems that make caring sustainable, policies that protect workers, data that drives decisions, and leaders who listen. When those elements align, purpose can become power. Every workforce strategy carries an ethical weight. We must invest in people without exploiting them, and close gaps without creating new ones. True engagement is built on dignity, ensuring that every healthcare worker, everywhere, is valued for their contributions. Around the world, innovation takes many forms. In Cuba, investment in education has created a ripple effect, exporting skilled clinicians and training programs worldwide. In Africa, the CDC's regional hubs connect nations to share workforce strategies and build continental capacity. Each model, though, reflects the same principle. It is people, not programs, that are at the heart of progress. The future of global health depends on the strength and spirit of its people. Through this work, our group was reminded that engagement begins and ends with human connection. Let's invest in the systems that protect, empower, and inspire those who care for us. Because when we honor the mission of care, we don't just heal patients, we heal communities and ultimately the world. Thank you.
Perfect. We next have up from data to decisions, applying an enterprise architecture to build learning health systems in hospitals globally. Ms. Rebecca Hamilton, Assistant Director of Nursing from St. Andrew's Hospital in Australia. Great to see you. She will be talking from Working Group 8. Where's 8? Yay. Okay, spread out. I love this. We'll be talking and giving an overview of the Learning Health System, LHS, and the structure of enterprise architecture and a framework for implementation. Welcome to the podium.
Good afternoon, my name's Beck Hamilton, and I'm very honoured to represent my Young Executive Leader Working Group. I had the pleasure of working with Liz, Auntie, Jamie, and Abid, and together we set out to explore one fundamental question. If hospitals are producing more data than ever before, why do so many still struggle to turn that data into better decisions? Across every system we examined, whether public or private, developed or developing, the story was the same. Our hospitals are overflowing with data, yet starved of insight. Information is collected, reported, audited, but rarely makes it past compliance. Data is viewed in hindsight rather than in real time. The problem is not the absence of data, but the absence of structure, capability, and a shared understanding about how to use it well. We began by studying the learning health system. This concept recognises that hospitals are not static, but dynamic learning environments where every patient encounter offers an opportunity to improve. A learning health system continuously captures knowledge from daily practices, applies that learning at the point of care, and measures its impact on outcome. It is not a technology project, but a mindset shift. A culture that embraces continuous improvement supported by the right infrastructure. We found inspiring real-world examples. In Brazil, the Red to Green initiative transformed the management of inpatient flow using nothing more than color-coded data on delays. That simple visual system reduced average length of stay from 19 days to just over 14. By using data to identify avoidable waits, the hospital created space, improved patient outcomes, improved patient experience, and reduced cost. This is the power of a learning system in action, when information becomes insight and insight becomes better care. However, sustaining that kind of improvement is challenging. Too often hospitals celebrate pilot success but fail to scale it. The missing ingredient is not enthusiasm or expertise, it's architecture. This realization led us to enterprise architecture, a discipline far more familiar to government and industry than to health. Enterprise architecture provides the blueprint that connects business goals with data, applications, and technology. We use a model called BDAT, the Business Data Applications and Technology. The business layer defines the hospital's strategic and clinical priorities, such as improving discharge efficiencies and reducing readmissions. The data layer ensures we capture accurate and timely information to track progress. The applications layer provides the digital tools to make that data visible. And finally, the technology layer ensures the systems are secure, reliable, and able to communicate with one another. When these layers are connected, a hospital can learn, adapt, and evolve. When they're disconnected, learning stalls and decision-making becomes reactive rather than proactive. Building this alignment takes time and discipline. Hospitals are complex, multi-layered ecosystems with competing priorities, but enterprise architecture offers a path to begin. Our group identified 5 practical steps for any hospital to move from potential to performance. Our group first step was to assess readiness and establish a baseline. Understand your data maturity and where the biggest gaps lie. Second step, co-design a shared vision with both executive and clinicians so that everyone's working towards the same goal. Third step, build learning loops that connect data to daily decisions and generate feedback. Fourth, scale what works rather than constantly starting from scratch. And last, embed governance and culture so learning is not a project but a way of working. We also drew on Kotter's 8 steps to change management to show transformation succeeds when it's both led and lived. Hospitals must cultivate a sense of urgency, celebrate small wins, and maintain momentum through shared leadership. Transformation is not achieved through technology alone. It depends on people believing that change is both possible and worthwhile. In closing, I return to the question that began our work. Why do so many hospitals struggle to turn data into better decisions? The answer is that data alone does not create improvement. Design does. When we align our business goals, data, systems, and technology within a learning culture, we create the conditions for progress. Hospitals that learn are hospitals that improve. They become safer, more efficient, and more resilient. The future of healthcare will belong to those who can learn faster than they can change. From data to decisions, from dashboards to bedside action, the journey towards a learning health system begins not with technology, but with intention, architecture, and trust. If we build those principles at our core, our hospitals will not only care for patients of today, but will continually improve for the patients of tomorrow. Thank you.
I love the focus on trust. All right, Yale Healthcare Sustainability Efforts. Experiences from 6 countries, Brazil, Egypt, Kenya, Singapore, United Kingdom, and Zimbabwe. Dr. Christina Ping, Preventative Medicine resident from Singapore. Christina is from Yale Working Group 2. Where are you? It's all about teamwork. We'll present practical practices from the Yale towards net zero in healthcare.
Thank you. All right, thanks, Carrie. Good afternoon, I'm Christina once again, and I'm a preventive medicine resident from Singapore. It's my honor to represent my team seated up front and talk about the sustainability initiatives that we have done in our own institutions. So I would like to acknowledge my team members. We have Chloe from UK, Fernando from Brazil, Dennis from Kenya, Trima from Zimbabwe, Muhammad from Egypt. We would also like to thank the GSC team who has been supporting us through this, DT, Carmen, and Thomas, and especially I'd like to thank Maha Maya for giving advice for my project. And so this would be the flow of our presentation. First, I would like to talk about efforts on the department level, moving on to the hospital system level, the health system level, and ending off with efforts at the national level. At the department level for Fernando's project, he's reducing greenhouse gas emissions in the hospital's nutrition department by transiting from LPG consumption to renewable energy sources. Sorry for the pause. Okay, and this is done by installing LPG and energy meters to monitor their respective consumption, and replacing LPG-powered kitchen equipment with renewable energy-powered kitchen equipment. Additionally, electrical or hydraulic infrastructure upgrades were being done, and there was also comprehensive staff training for the nutrition team. And the nutrition menu was also reformulated to improve the meal preparation efficiency. And at the bottom, you can see the results really show. Next up, still at the department level, for Chloe's project, she delivered a green pediatric endoscopy theater to combat the high carbon footprint and the waste generated in that department, while at the same time still maintaining excellent clinical care. Through multiple stakeholder engagement, she implemented the shutdown theater checklist, transited from paper-based to digital patient pathways, and also redesigned the patient pathway to optimize resources and increase theater throughput. And at the hospital level, we have Dennis, who installed a portable biogas digester to convert the hospital's substantial daily food waste into biogas. This would reduce the use of LPG and also reduce the cost associated with disposing the said food waste. The anaerobic digestion of 60 kg of food waste can generate enough biogas to offset 10 to 15 kg of LPG for cooking and heating within the entire hospital. And also at the hospital level, that's my project. I wanted to increase Khoo Teck Hospital's staff awareness of climate health issues and as a starting point to drive climate action in the hospital by bringing them from awareness to action. And also, And this was done by using educational materials on climate and health to up the awareness level, placing behavioral nudge stickers around the hospital and creating a feedback platform to activate behavior, and also ultimately leading to self-motivated staff taking action. And at the health system level with Trimor's project, he's unfortunately not here today, but he drove healthcare sustainability through sustainable capacity expansion at private hospitals and provided consultation and climate resilience and carbon footprint reduction at public healthcare institutions. And lastly, we have Muhammad's project. At the national level, he reduced the electrical consumption, operational costs, and carbon footprint of healthcare facilities in Egypt. And by assessing baseline electricity consumption patterns, doing regular energy audits, and also by changing the culture and behavior on the national level. So we would like to thank you for your attention for this very short presentation. Scan the large QR code on the right if you'd like to learn more about our leadership journey, and connect with us on LinkedIn with that small QR code. Thank you very much.
The future is in good hands. When patients come first, building trust and better care across borders. Mohammed Qureshi from Pakistan. Mohammed, Yale Working Group 3. Where's Working Group 3? Oh, there we go. We'll focus on how patient experience directly contributes to improved clinical outcomes and operational efficiency across the globe. Congratulations.
Good afternoon, everyone. So the topic today, which I am presenting, is human-centered experience and impacting the clinical organization outcomes across the borders. So with me, our team, we have discovered how human experience working in all the states, like our team from the Indonesia, Nigeria, and Puerto Rico. The purpose of this topic is to just share our journey in different countries, how human experience is enhancing, what tools we are using, and the main thing that we are focusing is when human being caring for human being, then patient heal faster, staff feel motivated, and hospital become stronger and sustainable. So let's start story from the Indonesia. The Indonesia used the technology to enhance the patient experience. They use technology in preventing the medication errors, decreasing the discharge time, and also increasing the staff satisfaction. In the Pakistan, we use family and staff engagement and communication to enhance the patient and human experience. We start the patient experience rounds, we do the bedside discharge, and we do the next day recognition for the staff who did well. And in the Nigeria, we develop a program, REP, Respect, Empathy, and Professionalism, which help us in enhancing the motivation by 45%, absentees reduced by 22%, and satisfaction improved by 30%. So in Puerto Rico, there was no feedback system specific for the mental program, so we developed one, and we use these surveys